An incredible mind-reading device could help sufferers of serious strokes regain the use of their hands. Stroke is a leading cause of long-term disability in both the US and the UK, with about half of all survivors left with severely restricted movement in one hand. A new machine sends signals into a patient's head while moving their paralyzed hand with a robotic exoskeleton to strengthen lost connections between brain cells. A stroke is a brain attack similar to a heart attack and is mostly caused by a blockage of a blood vessel to part of the brain. The sooner a suspected stroke patient is seen by a doctor, a diagnosis made and treatment started, the greater the likelihood of recovery. Stroke is a leading cause of disability in the UK, where there are more than 100,000 cases each year. In the US, stroke is the #1 cause of serious, long-term disability, with around 800,000 cases a year. About half of all stroke survivors will never be able to use their affected hand for activities of daily living again. Current therapy is based on muscular strength training via specialized rehabilitation and physiotherapy sessions. The device detects electrical activity in the brain and causes the hand to open and close in response. Experts also use a magnetic pulse to stimulate a part of the brain associated with hand movement during the treatment. The treatment boosts the number of connections or pathways between the brain and spinal cord, the researchers claim. Lead researcher Professor Alireza Gharabaghi told MailOnline, this combined intervention recruits additional pathways from the brain to the hand which were not active before. To test if their system works, the team evaluated 27 participants, none of whom had suffered a stroke, as they used the device. The strength of brain connections linked to hand movement were measured before and after the experiments via changes in muscle electrical pulses. The team found that the strength of pulses sent from the brain to the hand increased after their therapy. The researchers demonstrate that stimulating the hand area of the motor cortex at the same time, but not after, the robotic device-initiated hand movement increased the strength of the neural signal. This was most likely by harnessing the processing power of additional neurons in the spine, they said. The signal decreased when participants were not required to imagine moving their hand. Delivering brain stimulation and robotic motor feedback simultaneously during rehabilitation may therefore be beneficial for patients who have lost voluntary muscle control, the researchers wrote in their paper.